afternoon. I'm Shawn Yao, and this is One News Now. Two manufacturers of self-test kits for COVID-19 are now applying for a special permit. For the details, we have Maricel Halili reporting to us live from Mandaluyong City. Maricel, good afternoon. What are the criteria of the Food and Drug Administration for the approval of these self-test COVID kits?
Hi, Shawn. Well, according to FDA Executive Director Gutierrez, there are two criteria that they must consider in giving or issuing permits to the manufacturer of self-test kits. First is the specificity. It should be at least 97%. And it means that this particular self-administered test can only identify COVID-19 virus. And then the second criteria is the sensitivity. It should be at least 80%. It means that the self-test kit can sense the presence of the virus.
So specificity is one of the two criteria. Now, will these self-test kits for COVID-19 be available for purchase over the counter once approved?
We asked that to FDA earlier, but according to Executive Director Gutierrez, they still have to wait for the guidelines which will be issued by the Health Department. The guidelines in the usage of the self-administered test is expected to be issued by the DOH on January 17. So we have to wait.
All right, so wait and see for that. We'll wait for January 17. That's already on Monday. Now, everyone is saying that for us to be upgraded to alert level 4 status, the hospital utilization rate should actually hit 70%. On the back of that, I want to ask how hospitals in the NCR are holding up amid the surge in cases. Is the One Hospital Command also a lot busier these days?
Yes, Shawn, they are indeed busier these days. Yusek Leopoldo Vega said that before the existence of Omicron variant, they actually received around 700 to 800 calls per day. That's the peak. But now they actually receive more than 1,200 calls per day in the One Hospital Command. Majority of these calls are, most of these calls are queries about the quarantine and isolation facilities. When it comes to the hospital utilization rate, particularly here in Metro Manila, Yusek Vega said that we're only at 60%. This is actually the reason why they cannot put Metro Manila under alert level 4, because one of the criteria or the parameters before a specific area can be declared under alert level 4 is that their hospital utilization rate must be at least 71%. But since we're still at 60%, we're still at moderate risk. Unfortunately, there are cities in Metro Manila that are actually suffering when it comes to the hospital utilization. It means that the hospitals for COVID patients are already full. These are Marikina City, Taguig, San Juan, and Quezon City. So we can see now the significance of the One Hospital Command, because it's very important that the government will move fast so that they can refer COVID patients from these 4 cities to other hospitals in the NCR.
Right, and I'm sure a lot of students are waiting for this announcement. Will limited in-person classes in college push through on January 31st despite this surge in cases?
Well, Shawn, it will depend on the assessment of the local government unit and their universities. The original plan of the Commission on Higher Education is that they will allow the opening of limited face-to-face classes in areas under alert level 3 this month. But they just decided last week that probably it will be better if the earliest date will be on January 31st. But it doesn't mean that they will really start the limited face-to-face classes on January 31st, because they still have to wait for the approval of the local government units, their universities, and of course, if the parents are in favor for the limited face-to-face classes. But CHED the chair, Prospero de Vera, said that some of the schools and university have already coordinated with CHED and have already told them that they will just start the limited face-to-face classes probably in February. They opt to just have or conduct online classes for now because of the surge of COVID-19 cases.
All right, thank you as usual for all those updates. Maricel Halili reporting to us live from Mandaluyong City. Thank you, Mase. And the health department has proposed new protocols for quarantine and testing among fully vaccinated individuals and their close contacts. Fully vaccinated persons who are asymptomatic and with mild symptoms can isolate for 7 days from the onset of symptoms. The 10-day isolation period remains for those that are partially vaccinated or unvaccinated and patients with moderate symptoms. For severe cases and immunocompromised individuals, the isolation period of 21 days is retained. For close contacts, the quarantine period for vaccinated individuals will be shortened to 5 days, while the full 14-day quarantine applies to partially and unvaccinated people. On testing protocols, the testing of asymptomatic close contacts will be no longer required unless symptoms manifest. RT-PCR testing will also be prioritized for health workers, senior citizens, and persons with comorbidities. Let's check in on some developments in Philippine politics. Cabinet officials under the administration of former President Fidel Ramos are backing the presidential candidacy of Vice President Leni Robredo. In a statement, the group said that Robredo is the most fit to lead the country. They added that Robredo possesses leadership qualities that Filipinos need in the country's next president. Vice Presidential Bet Sara Duterte reiterates her support for presidential candidate and running mate Bongbong Marcos despite calls for an Isko-Sara tandem online. In a video, the Davao City Mayor says that she believes in Marcos Jr.'s capacity to lead the country. Mayor Sara also stressed her loyalty to the Lakas CMD party and the Partido Federal ng Pilipinas. COMELEC has accredited Mothers for Change or MOCA party list to join the 2022 elections. The party is represented by OWA Deputy Administrator Mocha Uson and NTF LCAC Ambassador Michelle Gumabao. MOCA will be among the 177 party list groups that will be included in the 2022 ballot. We'll be back with more stories after the short break. Keep it here on One News. You're still watching One News Now. I'm Sean Yao. Roxas Boulevard will be partially closed to motorists in order to make way for much-needed repairs. Gerard de la Peña is reporting to us live from Roxas Boulevard rather. Gerard, is it really the southbound lane that will be closed off to motorists, and for how long?
Sean, this portion of Roxas Boulevard will be closed off to motorists starting this Saturday to make way for the much-needed repair of box culverts underneath. Specifically, Sean, this portion is the southbound lane between the corner of Hilpuyat Avenue and EDSA. The Public Works Department said they can keep one lane open for traffic to ensure the safety of both motorists and contractors. The DPWH stressed that the repair is urgent as the box culvert, which serves as the passageway of water from Pasay to Manila Bay, is already brittle. The box, as big as 2 dump trucks, was constructed in the 1970s and may crumble in the next 6 months if repairs aren't done. The MMDA said repairs will commence soon to take advantage of light traffic and low volume of shipments from the port area. Authorities said construction will last for 2 months. The northbound lane is also up for reconstruction, but no details are final as of yet. Sean, southbound motorists may instead turn right to the CCP or the Hilpuyat Avenue extension or at the corner of HK Sun Plaza, and then they can make their way going to Macapagal Boulevard. They can also turn left going to Quirino Avenue and onwards to Osmeña Highway. This is going to be the case for the next 2 months. Sean.
All right, so 2-month closure of a portion of the southbound lane of Roxas Boulevard. Thank you so much for that update, Gerard de la Peña, reporting to us live from Roxas Boulevard. Let's now take a quick look at today's other top stories. The Octa Research Group warns that several areas, including Baguio City and Angeles City, are at a mature stage of the Omicron variant transmission. The group also noted that the variant's transmission is accelerating in Naga City, Dagupan, Lucena, Olongapo, Iloilo City, and Lapu-Lapu City. The Transportation Department insists that the no vaccine, no ride policy in Metro Manila is not anti-poor. The DOTR explained that the policy grants exemptions regardless of social class. Some groups have expressed concern that the new protocol discriminates against poorer unvaccinated people who rely on public transport. Filipino pole vaulter E.J. Obiena successfully underwent knee surgery in Germany. Obiena had his left knee meniscus cleaned after an ACL reconstruction back in 2017. The Asian record holder is expected to compete in at least 5 major tournaments this year, including the Southeast Asian Games and the Asian Games. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I am Sean Yao. We are One News.